It's really a pleasure to be here, and thank you for inviting me. I think what I will be talking about is several aspects of that will intersect with the issues of climate change, health, but also in the world of data science, and as well as how data science can inform sustainability and scalability, especially in the context of the United States. So I'm going to deal with big, messy data and telling you a little bit about the effect of climate change on health as for the present and also what we're expecting for the future. I will try to have it a little bit also providing some, hopefully some better news and see what we can do today to avoid some of the catastrophic consequences that we are all really worried about. So let me tell you a little bit about, I divided this talk into 4 little parts. First of all, I wanted to tell you about the context of data science for informing environmental policies in the United States, and a study I have conducted at Harvard, which was the largest ever study conducted on 480 million person years in studying the health effects of air pollution and mortality. I will then talk about how data science and technological innovation, considering machine learning and artificial intelligence, can provide information of the current impact of climate change on health and potentially provide a sustainable and scalable solution. And then I will pivot into the world of data science and why the world of data science is now so important, I think both in the corporate world, in the government, and in academia. And then what is the Harvard Data Science Initiative and the new journal Harvard Data Science Review. So let me start with air pollution policy. Unfortunately, following the news, the current government in the United States has been trying to roll back a lot of the very important environmental regulation. And so I think if there is only one thing you want to bring home today from my talk is this quote, which is actually not my quote, but I never really figured out where it's coming from. But the quote is following, and it really speaks to me, which said, data science without policy is still science, but policy without data science is gambling. And what I mean by the word policy, I mean environmental policies, healthcare policy, farmer policy, agriculture policy, any type of policy, if it's not informed by data and by science, tend to fail. And this was a piece I wrote in Science very recently, really advocating and being extremely concerned about the current situation in the United States, where there tends to be a rolling back of our environmental policy, again, non-based on science, but based on what I will call it probably more on gambling. And we all know that the main sources of current air pollution, which is a burning fossil fuel, are exactly the same sources of climate change. Now, it's interesting that in the history in the United States and then also in the world, in Europe as well, this is a classical example where in the past, and hopefully we are not changing the trend, data science that has informed policy actually has been very effective. This is a trend that shows in the last few years now, my scale compared to my colleague scales feels really small, so only since the 1990s. But it shows how the ambient level of air quality and the different level of the contaminants in the air have declined quite a lot as a result of environmental policy that have been informed by data and by science. And unfortunately, based on all of this conversation we're having, there is a really danger that this is going to stop. So one of the studies I've been conducting in the last few years was really to asking the question, even in the context of air pollution level, ambient air pollution level, if we, even though we have been having a substantial improvement in the last 20 years all around the world, well, all around the world, I would say all around the developed world, is exposure to ambient level of air pollution that are below the national ambient air quality standards in the United States, which are lower standard, that are considered to be safe standard, are still associated with mortality risk. So basically the question is, if we take the largest possible available data, and if you look at whether even this lower level of air pollution are still harmful to human health. And it's important that the question to address, because that will speak to the need that we will continue, and we need to watch environmental regulation, and we cannot afford to relax this national ambient air quality standard. And most importantly, are some populations at higher risk than others? This type of question that were used in the context of data science and big data in the United States are, of course, particularly relevant, even more relevant in developing countries, where actually building larger research data platform can provide an answer and can guide environmental policy. So I am an absolutely big fan what I call about research data platform or digital platform. You can call it whatever you want. And going back to the two keywords that I have heard this morning of the importance of sustainability and importance of scalability. If you want to make a recommendation regarding sustainability, you have had to have the ability to track the progress, to see whether or not that progress is sustainable. And if you start slacking back, you can fix the system to go back on target. In terms of scalability, again, it's really important to have a large and flexible digital platform that you can make a recommendation at the local scale, at the very small, in the context of a small farmer, at the global scale, but also to be able to have an interconnected set of data that can form each other. So I led the creation of this research data platform. Is the largest ever, that basically in the United States link information on all of the environmental exposure from the level of air pollution in the air, greenhouse gases, weather. It links to health outcome. As you might know, in the United States, we don't have an healthcare system, but there is the Medicare, and Medicaid is the equivalent of an healthcare system for people older than 65. And that's where we got the 4,800 million years, where we were able to link environmental exposure to daily hospitalization and deaths for over 99% of the population in the United States older than 65. That correspond to 60 million people a year. And then we need to track all other information that can confound the relationship between these two. So I want to have it's a really funny quote, which is from Marilyn Monroe. And Marilyn Monroe said, and also speaks to me considering that I'm from Italy. So Marilyn Monroe said, give a girl the right shoes. And in my context, I would say, give the girl the right shoes and the right data, and she can conquer the world. And so I really do think that the importance of data and the importance of technology can really allow us and equip us to have policy at the global level, at the local level, being formed by data. So the air pollution study was a study that we have an open cohort of 60 million enrollees per year. We know their hospitalization every single day for every single of them throughout the entire period. So this would allow us to basically follow the entire population of the United States older than 65 for all the health information. The air pollution data comes from the EPA monitoring network, the Environmental Protection Agency, and that's where one element of computational scalability and data science can help. Even though the air quality in the United States is pretty well monitored, you can see that there are many areas where it's less monitored. And so that's where an element, which I think this is an idea where it can be scalable and it can be applicable in any country, is the use of machine learning and artificial intelligence when you take information from satellite data, from weather data, from land use data, and you use artificial intelligence and machine learning to be able to have accurate prediction of air pollution level. And so we were able to do that in the United States on 1 kilometer to 1 kilometer grid. And you can think about and now transfer these ideas when you are thinking about prediction or forecast of weather condition, of rain, or anything else all around the world, of course, including rural Africa. And so we were able to get daily 1 to 1 kilometer estimate of levels of air pollution in the air and linking it to the Medicare population. and providing, like one of the largest studies ever, where, for example, we had over 32 million people that we were able to study, and these are the 32 million of American citizens that live in areas, if you just look at the last column, these were 32 million Americans that were exposed to level of pollution that's supposed to be safe, because this was a level of pollution below the national ambient air quality standard. So really big data, but the importance here, and I want to quote my colleague, Xiaoli Meng, is a professor of statistics at Harvard, and also the editor-in-chief of our new launching journal, Harvard Data Science Review. We also have to be careful, because even if you have the largest possible research data platform, you have the largest possible data, these are bigger data, are messy data. So the bigger the data, he said, the surer we fool ourselves if we don't take into account data quality. So even if you have all the information in the world, the importance of data science and the importance of rigor is extremely important, because otherwise you can get wrong conclusion even from massive amount of data. So I'm just going to skip this, but basically I'm going to say that today what we found, these are hazard ratios. So these calculate the percentage increase in mortality associated with 10 units increase in fine particulate matter in the United States. And not surprising, what we are noticing is that the people that of color, the black, and the poorer, the people that are both eligible for Medicare and Medicaid, tends to be the one that have higher mortality risk. But as you can see, the horizontal line is centered at 1.07. That's the overall population. So basically said that for 10 microgram per cubic meter increase in PM2.5, even a level very below the national ambient air quality standard, we have a 7% increase in mortality. So big messy data and data science is important, because then that's really informed policy and has been used in the policy setting. This is Senator Cory Booker that's been talking about our study that actually has been stopping the attempt of the Trump administration to stop or to relax the current national ambient air quality standard. So big messy data, large research data platform, accurate data science to provide a sustainable and scalable solution for environmental policy. I'm just going to show you a few other information in terms of how data science and the large amount of data can inform the health impact of climate change. This is a study that we did and published in JAMA a few years ago, where we look again all the continental United States, the effect of extreme temperature and especially heat waves, all possible cause-specific hospitalization. And what we found, and again, this has been really important from a policy setting point, we look at all possible cause of hospitalization. So not only heat stroke, but any conceivable cause of hospitalization. And through rigorous statistical analysis, and again, taking several million of observation, we found that the other causes like fluid and electrolyte disorder, renal failure, urinary tract infection. These were all the causes that are most likely to cause an hospitalization among elderly during heat waves day than compared to match not heat wave days. And this is important because as we see, I mean, it has been reported that this has been, this last summer has been one of the hottest summer on record. I think it's really important to understand what type of health outcome and health impact these heat waves are having to prevent that and prevent disease. The other example is the wildfires. That is also very active research, not only on my group, but many other groups around the world. And again, here is where big data, machine learning, and artificial intelligence provide opportunity not only to estimate the health impact of wildfires now, but also the health impact of wildfires in the future. This is just a graph that shows, for example, that if you consider the difference in smoke wave intensity between now and in the future, considering a climate change scenario as business as usual, we were expecting, for different counties in the western United States, that we're going to have that in the present, or just in the past, I would say, between 2004 and 2009, we have about 57 million in the western United States experience a smoke wave. And now we're thinking that with the business as usual scenario, we have predicted that between 2046 and 2051, we're going to have over 82 million being affected. So you can see that, it is my own passion that in the context of this global, a huge societal problem in the context of climate change, data science is a critical, important role, but also the interconnection and the collaboration is important. So one of the critical questions of the Harvard Data Science Initiative, so the Harvard Data Science Initiative is a cross-faculty initiative that reports directly to the president and the provost of Harvard to really bring faculty together across all schools, from the law school, from the computer science, from public health, and really tackle together how can innovation solve major societal problem. We have structured ourselves of bringing faculty together across a different sector to address all of these important problems, ranging from networks and markets to personalized health, to evidence-based policy, to data-driven scientific discovery, as well as with the rigor in this analysis of data that is necessary. So this is just a snapshot in terms of, we have the data science fellows, for example, in the context of climate change. It's really important to have the best minds across the world to be able to connect with faculty across many disciplines to really tackle together important problems. We have a master problem in data science, many faculty engaged. And so to conclude, I also want to mention something that we have been very excited at Harvard as the tradition of creating the Harvard Business Review Journal, and they have an Harvard Law Review Journal. We decided that in this new world of data science was really important to create what we call the Harvard Data Science Review Journal. And it's, as I said, I mentioned before Zhao Limang, that is pictured is on the top left corner of the picture, is the editor-in-chief. And he, I think, nicely capture the importance of, the characteristics of the journal, because he called it a microscopic, telescopic, and kaleidoscopic view of data science. And really among the editorial board, we really stressed the importance of thinking about data science together with industry and together with the government and together with many other academic units. I'm also very proud to mention that Harvard Data Science Review is published by MIT, so which is, just speaking about, which generally is considered our biggest competitors, which actually we wanted to do it together with them. So finally, I just want to say that we really wanted to, going back to what Liam was mentioning, is really important for us to partner with industry to understand where the social innovation and where their goals are, so then we can bring the best of academia to solve this problem together. So thank you very much for your attention, and I'll love to have any questions.